The question is that the proposed expenditure be agreed to, and I call the member for Bullwinkel.
Thank you, Speaker. Today I rise to speak in support of the Appropriations Bills, and I do so not just as the member of Bullwinkel, but as somebody who has spent their entire professional life on the front line of our health services. Before I entered this place, I spent my career as a nurse and midwife, and I have cared for people when they're sick and injured, and I have comforted worried families, and I have seen firsthand the incredible pressure on our doctors, nurses and allied health professionals. I know what a strong, properly funded public health system looks like, and over the last decade I saw what a decade of cuts and neglect from the opposition did to it. I saw money taken out of hospitals. I saw dedicated GPs struggling to attract and retain the healthcare workers that they so desperately need. When we came to government 3 years ago, Medicare was in the worst state of its 40-year history. So that's why I'm so incredibly proud to be part of the Albanese Labor government that is turning this around. We are not just patching up the damage, we are rebuilding our health workforce and strengthening Medicare for generations to come. And the results, Speaker, speak for themselves. In the last 2 years, more doctors joined our healthcare system than any time in the past decade. An extra 17,000 doctors have registered to practice across Australia. That is the strongest workforce recovery in memory. We are seeing many junior doctors training to become GPs, primarily because they can finally see a government that values and invests in primary health care. This budget builds on that momentum with a $617 million investment to deliver even more doctors and nurses where they are most needed. We are expanding GP training with an extra 400 places from 2028, and crucially, we are creating powerful incentives for junior doctors to choose general practice, bridging the pay gap that they face when they leave the hospital system, and providing them also with paid parental and study leave. This funding is a game changer for regional and outer urban areas like the electorate of Bullwinkel. For too long, we have struggled to get young doctors to make a life in the country, but initiatives like the single employer model trials, which give medical registrars the security of a single employer while they train in rural general practices, are making that choice easier. And speaking as a nurse and midwife, I'm particularly thrilled by our government's commitment to my colleagues. We are funding an additional 400 scholarships for nurses and midwives to extend their skills and become nurse practitioners or endorsed midwives. These highly skilled clinicians are the backbone of regional healthcare, and supporting them to work within their full scope of practice means better care for everyone. But we know that one of the biggest barriers for young health professionals wanting to work in regional areas is the burden of student debt. And that is why our Help for Rural Doctors and Nurse Practitioners initiative is so crucial. This policy means that a doctor or nurse practitioner who chooses to live and work in a rural town like Beverley, Toodyay, Northam or York, or other country and remote communities, could have their entire HECS debt, their help debt, wiped clean through this policy. But it's not just a policy, it's a powerful statement that we value our regional workforce and we will back them in. Speaker, after a decade of neglect, we are delivering doctors and nurses to the regional areas, and we are providing the support our system needs. We have more doctors, we have more bulk billing, and we have urgent care clinics that have the immense pressure of taking pressure off the emergency departments. We said we would deliver 50 in 2022, we delivered 87, and now we're committing to another 50. When people are too sick for GPs or it can't wait, but it's not an emergency department issue, they have the option of going to the urgent care clinics where they just need their Medicare card. We believe that the investments in these are not just numbers on a page, they're committed to helping people, particularly in rural areas such as those in my electorate. Thank Thank you.